We have Michael here, and Michael is a Marine, and he's also a student now too. You're getting close to being done with your education?
I am, yes.
Good job. And we've been working with Michael. He likes to try to stay fit, right? It's a lifelong journey of staying fit, working on some CrossFit. He comes in, has complaints usually of hip pain, low back pain. Last time this is our second adjustment for this week. A little bit sore after the treatment, but he described it as feeling like a workout type sore. So totally normal when people feel that. As you can see, I have the heating pad here to loosen him up, warm things up a little bit before we start adjusting. Michael prefers more of the manual type styles of adjusting. So people that like to feel a little bit more movement with their body, in the spine, the hips. I do full spine, full body adjusting, so you see the traction going on him as well. I assist in some of the tractioning and some of the fascia and tissues by distracting and placing my hands in different positions on the spine and the body here. What was the WOD for the day, workout of the day?
It was a lot of running and a lot of wall balls.
Do you feel like you're in balance now with the wobbles?
Yeah. It was good.
And we're going to remove the heating pad. Oops. Good. And I like to place, just because I know some of Michael's history here, I like to place my thumbs right on the spinous area, L5S1. Just so he gets a nice little traction. What's happening when I do that is actually the disc is being stretched and hydrated. So a nice, do you feel that when I do that, Michael?
I do, it feels good.
Not too much. Sometimes people after receiving this feel a little stiff or sore. I have it on the lowest setting, not very fast on him, but definitely helps the disc. Maybe I should do a audio blog or a video on that, talking about why you have to adjust the mirror in your car in the morning, in the afternoon, because we lose our disc height. Okay, let's check him out here. So right short leg, he just got adjusted, was it a couple days ago?
Was it Monday?
Yeah, it was Monday. So he's about a ½ inch, so much better. You can see how that goes a little bit shorter, more than a ½ inch. So we're going to be looking at L4, L5. I want you to lay on this side for me. I'm going to do more of a traditional style adjusting. He actually prefers this type of adjustment, diversified side posture. And so you'll see my fingers go right into this area of L4, L5. You'll watch as I bring them in. There it is. Face down for me, sir. So both legs are now even, position 1. You can see that maybe from there. Now watch in position 2. And look at the difference. So the range of motion definitely increases. So that nerves talk to the muscles. They talk, especially as we start working up different portions of muscles, whether hamstrings, calves. You can see the difference. Legs are balanced. In fact, they're more relaxed. As soon as I adjusted that, got it back in alignment, those nerves are talking to the area to relax. All right, let's do a couple tests here. Raise this leg without bending the knee. Back down, try the other one. Back down. Big difference. You saw that where the left leg didn't raise up. So we're going to adjust the sacrum. Here's one style of adjusting him. We're adjusting the actual sacrum off to the side. Let's see if we got that. Go ahead and raise this leg. A little better. Let's have you lay on this side. He responds, like I said, best when we do the side posture. Not all people like this motion or movement to their body. Let the body go right into me, Michael.
Okay.
So I'm going to lean into you. Breathe. Face down. Now watch what happens when we do the work with that left leg. So raise that left leg up for me. Much better. Stronger. Nerves are communicating back down to the muscle again. Muscles, or the grouping of muscles there. Better through here. You got to use that foam roller on those quads, sir, and hamstrings. All right, both hands lower back for me. Now we're checking. Yep. Checking L2 area. And you can see the difference in the leg length there, so hands down, excuse me. We're gonna adjust L2. This is the upper lower back. Both hands back there again for me. Good. Now look at how much further they can adjust with that. Good job. Hands down. Now we're going to check some of the thoracic area, right in the mid back. Take a breath. Release it out. Good. Breath. Release. Good. Go ahead, lay on your back. It responds really well, very well with the treatment that we do. I see Michael as needed, but we're doing a follow-up breath in and out. Good. All right, relax. And I'm gonna have you come over here with the camera. Now, Michael has something, do you mind me sharing the syringa?
Absolutely.
It's called Arnold Chiari, but it's, for you, was it less than 5 millimeters?
It was 2 millimeters.
2 millimeters. What that is with Arnold Chiari, you have the spinal cord, and there's different positions or different portions of the brain or brain stem. And so what happens is that through the hole in the back or down at the bottom of the base of our skull is a foramen. They actually call it the foramen magnum. But what happens is it invaginates or kind of slips through in that area portion of the brain stem. It's real minor with him. I have some patients that it's even a greater degree. So chiropractic can be really helpful with people like that, especially if there's been any kind of traumatic brain injury, trauma to the neck. Now, I've been working with Michael for a while, so he likes the hand adjusting, but I'm going to show you something that we do that has been the most beneficial with him. Lift your head for me, back down. You're going to feel and see quick traction and pull. There it is. Good. You good?
Mm-hmm.
And like I said, I do full spine, full body adjusting. So I like to check the hip alignment, the knee, and the ankle alignment. He's so active. Nice release there, good. And I'm really glad you're staying active because better health for you. Good. Of course, I would get you after a CrossFit workout.
Yeah.
All right, I want you to sit up, face a chair to your left. Good. We're going to check shoulders as well. So we bring shoulders back. Drop your head. Thank you. Good. Good. And then we'll be doing, we'll smooth out the rough spots, right? I like to use the massager in there, helps to relax things, bring fresh blood to the area. We go right between his shoulder blades. We hold a lot of this tension and tightness right through here, base of the neck. You good? Mm-hmm. And I know he has sometimes hip pain, so we're going to actually adjust the hips with the instrument. I'll show you that in a minute. You good?
I'm great.
You're not getting that hip clicking as much anymore, are you?
No, I'm not actually. It's really died down.
Notice how he's sitting nice and straight, nice arch into the lower back. want you to bring your knees together, knees apart, right knee up, right knee down, knees together, knees apart, left knee up, left knee down. Helps stimulate the SI joints. I see that a lot on him, so I like to reinforce what I already did. We're going to work on the shoulder area, work on some of the pressure points. We're adjusting the clavicle, distal part or furthest point, humerus, not very funny. Right here, teres major, minor muscles, and the rhomboids right here on him. Same thing, opposite side. Right in the middle of the deltoid. Teres major, minor right here. You're righty or lefty?
Righty.
And we'll check ribs, T1, T2. All right. Get up, move around, Michael. How was that? Good?
It's fantastic.
Anything you want to share with anyone about your experience here, what it was like?
No, I just always had a great time. I always come in feeling tight and feeling hurting, but I always walk out feeling great. So
Much better.
Yeah, much better every time.
You're awesome. Thank you. I appreciate it.
I appreciate it.
I'm Dr. David Warwick, Warwick Chiropractic, Olympia, Lacey, Washington area. I'll see you soon. You might